Harkins, Hickman, Hill, Hobson, McMahon, Tate, Turner Ford, Wiggins. We have a quorum.
The first four bills have in common that they're attempts to deal with matters that are pending, but as the lawyers sometimes say, not yet ripe. There is the overwhelming issue of the Rural Health Transformation Fund, which governor takes the position that based on the application he sent in federal law, that he, the governor, has the authority to determine how that money is spent. I hope I'm not misstating that, but I think that's where we are. So far as I know, there's been no public announcement of the governor's plans for those funds. There is a feeling among some of us in the legislature that at a minimum, the legislature should have some input into those funds. I'm of the old school that it's always useful to have people sit around a table and have a conversation and try to work something out. But none of that has occurred yet. So that's going on. Simultaneously, but related to that, is the issue of the Greenwood Hospital. The Greenwood Hospital at one time was what I describe as a full service hospital. And I choose that term because I think it has no real meaning. And so I'm not tied to any specific things, but they had a hospital with a wide variety of services. For a variety of reasons, sort of a perfect storm over the years, after first one thing and another. Now the situation is the hospital is much less than it used to be. The building that it's in has problems. There have been problems with the board, and the hospital is struggling to hold on, and the board is looking for a solution. This came to a head, and this story explains part of what I see as the dilemma. The Greenwood Hospital was overpaid, I think, about $7 million in some Medicaid funds at one point. They need to repay that money. But the hospital doesn't have a lot of cash on hand. They can't write a check for $7 million. They receive a payment from Medicaid every month. They thought they had some sort of payment plan worked out, but during the 1st of December, Medicaid announced that they would recoup $2 million of the missing $7 million from the December payment. And upon learning this, the Greenwood Hospital says, if you do that, literally we can't make payroll at Christmas. We don't have $2 million cash. And if you don't send more money than that, we're going to be out of business. The hospital filed a petition in Chancery Court hoping to avoid that. At that point, Representative Creekmore, the chairman in House, and I filed a statement with the court saying we'd been hoping to, and Chairman Creekmore and I talk about public health stuff, to use a technical term, a lot. And we talked about the Greenwood Hospital a lot and thought that it would be something we might try to deal with at this session. So we thought it useful to file a statement with the court saying basically we were going to look at this. But if the hospital closes down before the legislature goes into session, there won't be anything left for us to consider. So there is a court order. The last I heard, there was some difference of opinion between the Greenwood Hospital and Medicaid about a couple of words in that order and their meaning. I don't know. Meantime, Mr. Creekmore and I went to Greenwood twice in December and met with the board. And it's our impression, and we had local legislators involved. It's our impression that the hospital board, at least, and the representation is that a good bit of the community just needs somebody to come operate a hospital in Greenwood with the most services that are feasible. And if somebody's willing to do that, the local community's willing to welcome them with open arms. That's an oversimplification, but that's my understanding. Meanwhile, Chairman Creekmore and I have made the representation, which I think is accurate, that if there is a solution for Greenwood, the legislature is interested in doing some things to help. We don't know what those things are. Some of it may involve money, don't know. But until there's a plan on the table for this is something we could do at Greenville, if we could find a way to get X million dollars, then you could talk about, is there some way to get X million dollars and is this a plan everybody likes? So I say that to say that the Greenwood Hospital proposition is up in the air. We need to keep alive every vehicle we can, including bills that can be amended for the purpose of doing something to help the Greenwood Hospital. If that becomes possible during this session, I don't know that it will. Just like, in my opinion, we need to keep alive legislation to deal with the Rural Health Transformation Fund, and matters related to it. And I think I could go into more detail, but this has been a fairly long monologue. So what the first four items have in common is this. They're all for the purpose of keeping vehicles alive. Two of them bring forward code sections. Or if you bring forward a code section, you haven't done anything except literally got a vehicle. The Rural Health Transformation Fund goes beyond that. There's a proposed committee substitute for the Regional Health Authority language, which is 2750, which again is a vehicle. I want to make it clear. I'm not going to support anything involving the Delta that senators from the Delta don't support. And I think it's very doubtful that this bill in anything like its current form is actually going to become law. But it has provisions in there which might somehow, some way be of use to Greenwood. We need that vehicle. And the proposed committee sub also contains a prohibition saying that the Division of Medicaid cannot recoup the $7 million until May the 1st. That's probably not worded exactly as it should be. It's doubtful that it becomes law exactly in that fashion. But given the history of what happened in December, I think we need to keep a vehicle alive. I can't figure out any reason that there should be an effort to take $2 million away from Greenwood all of a sudden in December, but that happened, and I'm worried about other things. So does the committee sub that I described for 2570, is that in the packet? Have we got that here in front of us? Oh, okay. Well, can we get the separate committee sub for 2750 passed out? 2570. Yes. Section, the first part of the bill. Okay. Section 1 of the bill simply says they'll not collect funds until May the 1st. And the rest of the bill is the broad bill that you're understood. So that's an explanation of the 4 items under Roman numeral 1. I would entertain a motion, if someone were to make such a motion, that we consider the 4 of them as a block, with 2 of them that are just bringing forward code sections being as is, one of them being having a reverse repealer, and one of them, the 4th one that we've just discussed, having that provision with a reverse repealer. Senator Johnson so moves. All in favor say aye.
Aye.
All opposed, no. Here's the ayes have it. The ayes have it. After all of that, the members of the committee have questions. If not, Senator Johnson moves title sufficient do pass, title sufficient do pass as amended, title sufficient do pass committee sub as appropriate. Ready to vote on that? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I thank the committee, and I assure you, all in the world I'm trying to do is make sure that if we can give some relief to some people, we've got the ability to do it. And if we can ever work out something about the Rural Health Transformation Fund, which I sure think is in everybody's best interest, we've got vehicles to deal with that if and when the time comes. Moving on now to Roman numeral number 2. These are 2 bills dealing with certificates of need. And I think that we've discussed several times CON issues, just as a technical matter, because nothing's ever simple. We passed a certificate of need bill last year. The governor vetoed it because he objected to one provision. The veto message says he would sign a bill without that provision. As you know, we had a special session. The governor did not choose to put that in the call for the special session. We convened this week as quickly as I could get the bill from the House, which took several weeks. We immediately took it up as soon as I was permitted to do so over here. It's finally gone to the governor, and it's due back from the governor tomorrow. Our computer system does not recognize that as existing law, and I don't think it will recognize it as existing law for this entire session. So the CON bills that you see this session, until we get to the end, are going to be based on the law before that bill becomes law, assuming the governor acts positively on it between now and tomorrow. Because if not, we're going to have all those underlinings and sit and talk about all that stuff repeatedly. But the bill that's before you does not take into account the provisions in House Bill 3. Although they will conform everything when we get to the end and get ready to send something to the governor. 2474 is the bill dealing with rural hospitals, and I will entertain a motion that we consider that bill. Is there such a motion? There is a motion that title sufficient do pass committee substitute. And I think you have a proposed committee substitute for 2474. Do people have that? Okay. The relevant language in this bill oh, it's section 1. Okay. The relevant term, the relevant portion of this bill is section 1, which is just the first few pages. There's been discussion, and in the most general terms, I think this is well considered, that we should do some things to help rural hospitals. And among those things are allowing rural hospitals to obtain certificates of need for various things, which might enhance their services or might allow or might help them to get additional funds with which to keep operating. One of the questions is how you define a rural hospital. This bill defines a rural hospital as a hospital which is located in a county that does not have a municipality of 15,000 or more people, or a county which includes a portion of a city that has a population of 15,000 or more, and it includes Washington County. So that gets basically the delta, and it gets rural counties across the state. If you've got, if you don't have a city of 15,000 or more, that would include those hospitals. It does not include critical rural, I never can remember the word, was the rural emergency hospitals, which by their definition are limited in what they can do. So there are a handful of those in the state, they're not included. One of the discussions was that it would be useful to have dialysis units, that this would allow rural hospitals to have staff which would allow them to perform inpatient dialysis, which they can already do. It's just not practical for them to do it. And if that took place, then they could continue to house patients who needed dialysis but could not obtain dialysis at that facility. The more I've talked to people with hospitals and talked about the mechanics of operating a dialysis unit and trying to figure out how you would manage the personnel, the less confidence I have that that's a solution for a number of hospitals, but it may be. So what this does is establish a provision that up to 3 rural hospitals can obtain a license, notwithstanding the CON law, just obtain a license to operate an outpatient dialysis system facility, which must be located within 5 miles of the hospital. There are also discussions about ambulatory surgical facilities. This provision would allow not more than 3 hospitals to obtain an ambulatory surgical facility, as long as it was within 5 miles of the rural hospital's main location. It would also allow any rural hospital to operate a geriatric psychiatric unit. I think by the time all of this is over, we may go beyond that, but those are provisions, it seems to me, are steps in the right direction. And it seems that, to say the least, would be doing minimal harm, if any, if that were the law. So are there questions about any of that? There's one other provision of this law, and we'll discuss this more with the next bill. One of the major issues with CONs is the lengthy and expensive litigation that occurs after the Department of Health has decided to issue a CON. I think in the history of CONs, there has been one and only one case, I may be wrong, but I know of only one case in which the courts have overturned the decision of the state health officer in issuing a CON. There are endless situations in which a CON has been challenged, resulting in litigation and discovery and expense at the trial court level, followed by an appeal to the state Supreme Court, just to delay the issuance of the CON. I'm personally a very strong believer that a litigant or an interested party or somebody who's affected by a decision ought to have an opportunity to have his or her say about whether this decision is a good one or a bad one. But there's no good that's coming from the endless litigation that we're seeing. So I have written this language, and we'll discuss this proposition more when we get to Senator Blackwell's bill. This is the provision that's in this bill beginning on line 45. The decision of the state health officer to issue a license under this section is final and not subject to judicial review. Any person or entity which wishes to challenge the issuance of a license may file with the state health officer a request for reconsideration within 7 calendar days of the decision by the state health officer. If such a request is filed, the state health officer or his or her designee shall conduct a hearing no sooner than 14 days from the date of the original decision, and no later than 21 days from the date of the original decision, at which hearing the interested parties may be heard. The hearing shall be informal in nature, and there shall be no right to engage in discovery. The purpose of the hearing is to allow a party to offer an objection to the issuance of the license or to present in a summary fashion matters which may have been overlooked. After this hearing, the state health officer may decide not to issue the license, to further consider the issuance of the license, or to reaffirm his or her original decision. That decision also is not subject to judicial review. I don't know that this is the thing to do, but it's the best I could do trying to focus on the opportunity for somebody to say, you've made a mistake, listen to me, but then to wind the whole thing up. That in this bill is only due to the licenses in this bill, but we have Senator Blackwell's bill with more it's more broad-based, and this bill contains a reverse repealer. I would think that as we go through the process, the House has a bill, we have a bill. As these bills get out of committee, they're attracting more attention, and I'm fairly certain that what we'll come up with is something between the Senate bill and the House bill. I have not in my mind precluded anything, but I think this would be useful to get us this far down the line, see what we think about this, see what other considerations are there. So having said all that, are there questions? If there, Senator Hill.
I'd like to speak on the bill.
You may speak on the bill. Well, yeah, before you speak, the motion is title sufficient do pass committee sub. Hearing no other questions to debate, Senator Hill, you're recognized to speak on the motion.
Thank you, Mr. Chairman. I have no doubt that you did the best you could to try to fashion something to help these rural hospitals, but when I see in here that that there is no judicial review, that that there's no discovery, that nobody has the opportunity to present any evidence in court, I think we were having some No Kings protests around here not too long ago. And this looks like a kingdom to me. And to, shift everything into one basket and try to prevent somebody from being able to, legitimately contest what would be awarded by the state health officer. And it's my contention that if we just got rid of these things altogether, called CONs, it would solve these problems. And we wouldn't have to try to protect and say somebody can't go to court, which I don't think that's going to stop somebody from going to court, even if we put it in the bill 15 times. But my concern is, yes, we want to do everything we can. I'm happy with them having stand-up surgical hospitals, freestanding emergency rooms. I think CMS even had a program to even help them change their business model in these rural hospitals and cater to the way medicine is done now rather than the way medicine was done when these hospitals were built. But this CON thing is a problem, Senator, and I know you're trying to deal with it, and I respect that you're trying to deal with it. But instead of trying to say, we're going to let these hospitals do this, but yet we're going to restrict UMMC from, using their academic exemption if they're this many miles away from their facility, but if it's a rural hospital and it's this many miles away from their facility, they can have a dialysis unit or a stand-up surgical hospital. We got to quit picking and choosing and let the market work and let people bring in healthcare and deliver healthcare where it's needed. And God knows it's needed all over Mississippi. I don't think there's a shortage of sick people in Mississippi. So, for that reason and the things that are in this, the things that are written in this bill, I want to help rural hospitals. I want to give them freedom to do whatever they want to do, but I don't want to penalize somebody else while we're trying to pick and choose who we're going to help and who we're not.
Well, this is the difficulty with the free market and the difficulty with not having certificates of need. We have plenty of sick people in Mississippi, but not all of them have any means with which to pay for their health care. The way that the healthcare system has evolved in this country is that, generally speaking, if you're a healthcare facility, and there are a lot of hospitals that are doing this and have been for years, if you have a payment mix which includes a good number of people with private insurance, a reasonable number of people with Medicare and Medicaid, and a small number of uninsured people, the revenue you get from the other operations allows you to care for the uninsured who are sick but can't pay you. That sort of is the model that we have. One of the problems at the Greenwood Hospital, and one of the problems with others looking at that, and there's no trouble, there's a certificate of need that's there for the taking in Greenwood. But it's very difficult to get anybody to go put a hospital in Greenwood because of the payment mix. Because if you put your hospital there, you'll have a lot of sick people, but not a sufficient number with private insurance and not a sufficient number who can pay to provide the service. And so that's why we have the certificate of need process. The other thing that happens is when for-profit companies locate facilities, we'll stipulate that they're taking care of sick people. That's what they do. But they also locate at a place where they can make money. And as the people who can pay and the people with private insurance are attracted to these facilities, it makes the payment mix worse for everybody else. That's the dilemma we face, and that's the practical effect of certificates of need. I understand Senator Hill's position is we just shouldn't have them. A lot of people have that position. I'm just explaining best I can the problems I see if we did not have a certificate of need system. Having said that, are you ready to vote on the motion? The motion's title sufficient, do pass, committee sub. All in favor say aye. All opposed, no. It appears the ayes have it. The ayes have it. House Bill 2538 is Senator Blackwell's bill. Senator Blackwell, would you care to make a motion, title sufficient, do pass on your own bill as amended? We'll offer an amendment, then you can have that. Would you be willing to offer a reverse repealer as an amendment? That's an excellent amendment. Let's vote on the reverse repealer first. All in favor say aye. Senator Hill.
Can we at least know what the bill does before we vote on it?
Yes,
Somebody-
it provides that there will be no that if you have a hearing on a CON and you lose the hearing, you pay the fees. Senator Blackwell's bill is a bill to reach the problem of endless and expensive appeals about certificate of need. One of the things that Senator Blackwell is offering in his bill is a proposal to have the loser pay the expenses of the winning litigant.
Y'all
That's an option.
me, I can't do this by myself. Okay, Senator, so his bill is gonna say that, well, this bill you just passed through here says there's no judicial review, and then his bill is gonna say if you even have a hearing and you lose, you're gonna have to pay for the cost. Am I correct?
Senator Hill, what I'm trying to do is get vehicles for us to consider this problem. And I sure thought the problem of these endless appeals is something that was just universally agreed upon. But I share your concern about people having the right to have their say. But the bill we just passed only dealt with the rural hospital proposition. The bill that Senator Blackwell has is applicable to all CONs, to all appeals. And what I've asked is for Senator Blackwell and some other people to look into this issue.
It's just concerning that it seems like we're amassing more and more power with the health department rather than giving more flexibility, is what it sounds to me like. We're saying we want to give more flexibility for rural hospitals to prop up whatever facilities that they need, but yet we're concentrating more power and more punitive measures to anybody that would dare challenge what the health department is doing. I'm not so sure that that's what I was sent up here for.
I understand what you're saying, Senator Hill. I can just tell you that over decades and decades and decades of this process, so far as I know, there has been one situation in which the hearing, the decision of the State Department of Health was overturned. And there have been scores of cases in which the loser or someone who did not want their competitor to get a CON engaged in litigation and delay and expense, at the end of which the decision of the State Department of Health was upheld. But again, the purpose of this is not so much to pass Senator Blackwell's bill, but Senator Blackwell has been introducing bills in this area for a long time. Generally concerned there is a problem. What I have done is that I have asked 4 members of the committee to look into this further. I've asked Senator England, Senator Blackwell, Senator Hickman, and Senator Johnson to look into this, to contact the National Council of State Legislatures. I believe it to be the case, and we've made contact with them, that there are a large number of states that have no judicial review. This would not be an unusual thing for Mississippi to do. But that's where I'd like to head with the bill. But the motion that Senator Blackwell is made is for a reverse repealer. So technically, the matter before us is the reverse repealer itself. Are you ready to vote on the amendment for the reverse repealer? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Now we're on Senator Blackwell's bill, and I'm going to recognize Senator Blackwell to speak on the bill. But again, I want to make people aware, I have asked these 4 members of the committee to talk with the National Council of State Legislatures. They've made contact with an individual. I'll bet we can get a good bit of information from them about what other states do and what solutions have worked and have not. But having said that, Senator Blackwell, you're recognized to speak on your own bill.
Thank you, Mr. Chairman. This is basically a loser pay bill. Senator Hill, to go through this process, in order to apply for certificate of need, you have to use the health plan and information that's in that document. You also have to demonstrate a need, and generally that need period is going to run from 12 to 24 months, so that you're providing services, you're short on services, and you want to add things. Well, then you have to go and you have to use the state health plan, which is the data from that, which is usually about a year behind. Then you make your application. You go through that process, and then you have an opponent who can test you, and they draw this out, and they can draw it out for another 18 to 24 months before you are awarded your certificate of need. And according to Senator Bryan, I think there's only been one. Is that the Methodist? I think we discussed.
The situation with the Methodist Hospital is the only one I know of, and that was a very unusual situation when it sure appeared that the state health department just got that one wrong.
Right. But that's been the only one in decades of applications. So basically what happens is the competitor can use this process to delay their opposition from upgrading their services from anywhere from 2 to 5 years after they've already demonstrated a need. So they've gone through a hearing. The court has, the health officer has made a ruling. So if your opponents oppose that and put you through an additional cost, yes, then, and you prevail, this bill would require them to pay your attorney fees in hopes of trying to limit some of these frivolous actions.
Senator Hill.
So all the actions may not be frivolous if someone is trying to bring a facility into the state of Mississippi. And quite honestly, they can't be called a competitor because they're not being granted a certificate of need. And that's exactly why they're not being granted a certificate of need, because they don't want a competitor. So I think all this, I guess what I'm asking is, you know, when we clearly have enough sick people to go around, why? And we have people needing to get into rehabs. I mean, sometimes it's hard to get people into rehabs. I cannot for the life of me understand why we're keeping out people that want to bring good medical care into this state, and we're making it more and more punitive for them to try to do so.
No, we're not. You don't know what the heck you're talking about. If you'd like, I'll be happy to spend some time with you offline and sit down and go through the certificate of need process with you. This is trying to get services. And in fact, we had a situation in the Delta where we had an ambulatory surgery center wanted to open. Someone opposed them. They could not survive the timeline that it was going to take for them to get a hearing. And so now there's no ASC in that region of the Delta. That's what these, how these bills are used to prevent competitors from coming in or prevent your opposition from offering additional services.
And some are being litigated, or some are being prevented from coming in because, like with rehabs, people need the beds, but yet we can't get another certificate of need. That's my point. That's my point. And I don't pretend to understand it all, but I do pretend to know that if we just let freedom happen and people that can provide a service, that have the money and they're not asking somebody to give them the money, and that they can provide health care to people, I think we just need to let them provide health care to people. But I'm sure that is not common to the upper echelons of healthcare in Mississippi, but I think that the most of the people that I talk to in my area would like, and they believe it would drive down cost, but maybe I'm wrong.
You're kind of talking about two different things, and I agree with you on the service standpoint. And that's what Chairman Bryan, Chairman Creekmore have been trying to do, is go through this whole certificate of need process and try to eliminate some of these hurdles so that we can get services to these places.
Senator England.
Thank you, Senator Bryan. As a new member of this committee, I do appreciate the work that is going into trying to fix this issue that we're having with making sure we have healthcare in areas that need it. I do tend to agree that some of this may all be taken care of if we didn't have the CONs, but we have them, and we do have an issue with litigation costs. I guess my question is, with this bill now having a reverse repealer in it, and with several of us being tasked with looking to see what other states do to deal with this, we do expect this bill to be worked on more, and both of these two pieces of legislation to be worked on more once we have that other information, which is why we've got a reverse repealer in it. Is that correct?
If I had to predict, which is probably a mistake in the first place, but it seems to me at least a plausible and likely outcome of this is, with those of you in particular working on this bill, and of course it will come back to the committee. We have bills coming from the House, the number of opportunities for us to debate the problem of what you do about the huge expense that comes about and delay after the CON decision has been made. I'll bet we can pass some legislation that substantially alleviates that problem while still allowing people who think that a mistake has been made to be heard.
Thank you, Senator Bryan. And I would, I guess I'd just like to speak on the bill, maybe. I don't think I have a question, but I would like to speak on it at the proper time.
Well, I'll recognize you to speak right now. You've already got your microphone on and everything.
Thank you, Senator Bryan. Yeah, my green light shows that I'm on here. I know we've obviously got some heated debates going on about this, and I share the concerns that Senator Hill has, I think, with when judicial review and the appeal process is used to make this more expensive and more tedious and more time consuming. I think we all share that concern. I would just like the committee to know that I do take very seriously this task that you've given some of us to see what other states are doing with regard to this, because obviously we're having issues. This is something this committee has dealt with long before I was here on this committee as a first timer. But I don't have any problem with the bill going forward to continue the debate at this point, because I would like us to have a seat at the table and have some voice on this to maybe see how far we can get this effort this year to make sure we Mississippians are being provided with the best health care they can. And whether that includes CONs or not, I think we can get to that point if we just keep the debate going. So I do appreciate Senator Blackwell for agreeing to insert a reverse repealer on this so that conversation can continue and we can maybe address some of these concerns that, again, that I think I share that Senator Hill has. That's all I wanted to say. Thank you, Senator Bryan.
Anyone else? If not, the motion is title sufficient, do pass as amended. You ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. At this point, I'm going to go to the bottom of the page and take up Senate Bill 2557, it being a doubly referred bill. And I think that Senator Johnson introduced that bill.
Yes, sir.
Having introduced it, are you ready to discuss it?
Yes, sir. And I have an amendment that will be the bill.
Would you like to move title sufficient do pass and then move adoption of the amendment, and then we could debate your amendment?
Yes, sir.
The motion is title sufficient do pass. Then Senator Johnson's offered an amendment and moved its adoption, and I'll recognize Senator Johnson to speak on his amendment.
Thank you, Mr. Chairman. So last year, we passed a bill to require a registration for nicotine products being sold in the state. That registration was to be done with the Department of Revenue. And we found that there were two issues with the way that the language was worded. One was that it encompassed more than we expected it to encompass. And the other is that people found ways to skirt the rules. And so what we would like to do is add language that would add a definition to what we passed last year and be able to clarify what nicotine products are to be in the registry and capture the products that are currently skirting that registration process. So the amendment would be deleting lines 52 through 56 and inserting the definition of nicotine adjacent products. And that means any product, including but not limited to an electronic cigarette, a product designed to be ingested into the body by chewing, smoking, absorbing, dissolving, inhaling, or by any other means, or an electronic cigar or cigarillo, which contains a substance that has a chemical structure substantially similar to the chemical structure of nicotine, including but not limited to, and there's some words that I can't pronounce, but it goes on to say commonly referred to as metadone, and another word that I don't know that I can pronounce. And it essentially goes through to clarify that the products that are synthetic that would be nicotine-like and in a closed system. And that would be the update to the language. And I'm happy to answer any questions that I can on it.
You mentioned various devices, including a cigarillo. Would this language cover a tiparillo?
I'm not sure because I couldn't tell you what either is.
I have no idea what either are. I just remember the jingles. Questions? Debate? Anyone?
Move adoption of the
Senator
amendment.
Johnson moves adoption of the amendment. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Senator Johnson moves title sufficient do pass as amended. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Since we're down on this end of the agenda, let's move up one to Senate Bill 2886, which is a bill dealing with emergency power and fuel in nursing homes. And I will recognize Senator Parks for a motion title sufficient to pass. And Senator Parks also moves to amend the bill by adding a reverse repealer. And this is where we are on this bill. Senator Parks has called me from her very cold accommodations very far north. One of the things the recent ice storm has made us aware of is the need for electricity, particularly in nursing homes and personal care homes, and for a longer period of time when with more power than perhaps we thought was needed previously. Senator Jackson, among others, introduced this bill that's before us, which seeks to address that problem. I've discussed this with Senator Parks, and once again, I've asked Senator Parks and 3 other people, where I have the names down, even though I haven't mentioned it to you, to look into this situation, because this is where we are. Senator Parks can tell us the great need and the problems that are there, but I think we know that that's going on. But I doubt any of us know specifically what sort of generators, how many generators, how quickly we should have generators, or any of this, what the pitfalls may be. We're down here, we've got some time this session. So what my thought is, rather than us trying to debate all this now, or simply punt everything to the Department of Health right now, although we may wind up doing that, let's keep this bill alive and try to get information with a better idea of where to go. Did I say that right? Do you want to speak on the bill?
I think you have said quite enough and we could debate all afternoon.
Yes, I said quite enough. I've said more than enough, and not merely on this one topic, but I'm trying to do better.
Yes. But one of the things we learned during this storm that we've had is that we're inadequate. We're adequate in not only our nursing homes, but also our assisted livings, where we do not require backup power. I'm not going to sit here before you and say that, you know, to his point, that you need 5 generators and 400 gallons. That's not what we're here for today, but we are here to try to keep this bill alive so that we can make some determination of what would work best for our constituents and our owners of these establishments, along with the health of our citizens of Mississippi. So with that being said, I hope that we will do title sufficient amended to pass this along with a reverse repealer in it.
Anyone else? Senator Hill.
I just briefly would like to say that what Senator Parks is doing probably should have been done a long time ago. After Katrina, my grandmother was in a nursing home. She had a DNR. She was one of the last people to be evacuated out of that nursing home, and it was 117 degrees in there. Whereas Senator Parks's people were freezing because they didn't have any power or water. It was in the heat of the summer during Katrina, and that nursing home was 117 degrees when my grandmother was evacuated. And she was in a coma, so there was, you know, really not a whole lot anybody could do at that point except wait till they got her out.
Well, thank you, Senator Hill, and thank you for jogging my memory and thinking over this legislation. It dawned on me that we really do have the 2 extremes in the state of Mississippi. We have ice storms where the problem is lack of heat, and we have hurricanes where the problem is lack of cool air, and the problem of lack of power is common to the 2. So it really is something that affects all the areas of the state. It's ice season right now, so we're thinking about ice, but it gets to be hurricane season, we're going to be thinking about hurricanes. So I think you're exactly right. Senator Barnett, were you seeking recognition?
Yes, sir, Mr. Chairman. To Ms. Rita, Senator Parks, would you be open for a friendly amendment?
I would like at this time, if all would be willing, is to put the reverse repealer and let's work with it in the next few days.
Okay. Well, my amendment was just that we add our correctional facilities to this because they experienced the same thing, and we need to make sure that there is emergency power on hand when they're faced with similar things like the nursing homes, because those are the people that's in our care as well.
Okay.
Well, Senator Parks says that's okay with her if you want to make that amendment. So as I understand, your amendment is simply to include correctional facilities with the same language, basically that applies to nursing homes and personal care homes.
Yes.
Debate on that amendment? All in favor say aye. Opposed, no. The ayes have it. Anyone else? The motion's title sufficient do pass as amended. I have two amendments. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. Now going back to the regular order, the next item on the agenda is Senate Bill 2454, a series of changes proposed by the Board of Medical Licensure. Senator Blackwell, you introduced the bill. So I'll recognize you if you wish to move title sufficient do pass, or if you wish for us to come back to it later, we can do that too. Okay, Senator Blackwell.
So this bill,
We move title sufficient do pass, I said.
yes, sir.
Okay,
Thank you.
Senator Blackwell.
The Medical Practice Act has not been amended since 1980 when the bill was introduced to create the statute. And all this bill does is seeks to adhere to modern best practices for the regulation of the practice of medicine and to address issues reported in Peers 2024 evaluation of the Mississippi Board of Medical Licensure. In particular, the bill updates outdated language throughout the statute to meet modern standards. For example, in Section 1, beginning on line 55, updates the definition of the practice of medicine to include both allopathic and osteopathic medicine, and the term physician to include both medical doctors, MDs, and doctors of osteopathic medicine, DOs, and also clarifies who's exempt from the provision of the Medical Practice Act. Provides for a retired status for physicians who wish to retain their license but not actively practice medicine. It authorizes the board to seek the issuance of warrants for patient records or other information needed to complete investigations. It requires the decisions be made by the board, must be appealed within a 30-day time period. It allows individuals whose licenses were suspended or surrendered the ability to petition the board for reinstatement no less than 3, but no greater than 5 years. Updates the definition of the practice of medicine, expands the board's disciplinary authority. Authorizes the board to place a license on probation and assess punitive fines, and updates the board's composition by creating 3 new official board member positions for consumer members for the public. And that's an explanation of the bill. And we did this in concert with the Medical Licensure Board and up here.
Questions? Comments? I don't see any. Senator Blackwell moves title sufficient do pass. Ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Next is the Senate Bill 2458. Is there a motion title sufficient to pass? Senator Parks moves title sufficient to pass. This is a simple bill. Right now, the counties are required to provide child protection services and office. This just changes the existing law to say an adequate and habitable office. I think that if you think of somebody providing an office that isn't adequate and habitable, when you look at it, it's an indication of how serious the problems are here, yonder, and there. And so that's what Senator Simmons' bill does. Is there debate on the bill? If not, are you ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. We'll pass 2462. I think we got the wrong bill number, which was my fault, and go to Senate Bill 2543, the Interstate Dental and Dental Hygiene Licensure Compact. Senator Hickman, for some reason, you introduced this bill. Would you like to move its adoption and then tell us why?
I would.
The motion's title sufficient to pass. Senator Hickman.
Thank you, Mr. Chairman. This bill, first of all, is supported by both the Mississippi Dental Association and the Board of Dental Examiners. It creates a interstate dental and dental hygiene license compact. It creates one expedited licensure pathway. And we're also, from my understanding, the boards are trying to get ahead of an unfavorable compact that's coming down. With this compact, again, it provides an expedited licensure process. It also allows our state board to remain as an oversight of whatever's going on. It allows them to keep their control. Currently, I think it has been proposed. Right now, our session is earlier than most states, but it's been proposed in about 11 states, and Louisiana has already joined into this compact. That's a brief explanation of the bill, but the main purpose is, again, to offer an expedited licensure process or pathway when individuals want to practice from state to state, but to also get ahead of some other unfavorable compacts that may be coming.
Questions? Comments? Debate? You ready to vote? Senator Hickman moves title sufficient to pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2544, Senator Fillingane, you introduced this bill. Do you have a motion on your bill?
Thank you, Mr. Chairman. Title sufficient to pass.
You're recognized to speak on the motion title sufficient to pass. Senator Fillingane.
I do have an amendment I would like to offer at the appropriate time.
Whenever you feel is appropriate.
Thank you, Mr. Chairman. I would like to offer an amendment that would restrict the application of this language to only the GLP-1 drugs and to add a reverse repealer.
You understand the amendment? Do you want to explain the amendment, and in doing so, explain the bill, and we'll come back and vote on your amendment and then vote on the bill, if that's okay?
Totally at your discretion, Mr. Chairman.
Sir?
I defer to you on that.
But why don't you explain the bill and the effect the amendment will have?
Thank you, Mr. Chairman. So the problem that this bill is seeking to resolve is over the last several years, there's been an unprecedented amount of compounded weight loss drugs that have flooded the market. You've probably seen all the advertisements, often made from illicit, inauthentic, or substandard active pharmaceutical ingredients. And some bad actors have exploited people's desire, obviously, to be healthy and to have a lower weight across the country. I know I'm told that recently down in the Natchez area, the Board of Pharmacy was attempting to regulate an outfit that was selling these GLP-1 drugs out of a dry cleaners. So there are instances where people wanting to be healthy and wanting to, do right, get taken advantage of. And so in an effort to give the Board of Pharmacy the ability to regulate bad actors, I think that's where we come with this particular bill. And obviously more work needs to be done on it. It's a fairly recent creation, but that's the reason for the reverse repealer. And I would like to just restrict the language, if the committee deems appropriate, to just the GLP-1 drugs, because that seems to be where the problem has arisen. So with that being the case, obviously the title in Section 1 is the Mississippi Active Pharmaceutical Ingredient Quality Assurance Act. The requirements in the bill is it would be illegal for any business to sell, transfer, distribute the drug that was compounded under Section 503A of the Federal Food, Drug, and Cosmetic Act unless the person or entity compounding and supplying the GLP-1 drug meets certain quality standards, first and foremost being that the drugs are FDA approved. That's sort of the bottom line takeaway. Those standards, obviously, you can break those down, but using approved and pharmaceutically accepted bulk drug substances or APIs, active pharmaceutical ingredients that meet U.S. pharmacopoeia or FDA standards when available, ensuring that any API without a monograph either comes from the FDA approved drugs or appears on the FDA's approved list, and verifying the bulk drug substances are pharmaceutical grade and quality, and accompanied by the requisite valid certificates of analysis detailing the identity, content, impurities, and other safety information required by the FDA. Conducting and documenting quality control testing on these API batches before their use, and showing that the active pharmaceutical ingredients were manufactured in FDA-registered facilities that have been inspected within at least the last 2 years and found to be compliant. Then I think in section maybe 4, there's the record keeping and inspection for the Board of Pharmacy to do their quality checks. And then the penalties is listed in the next section, a fine of $1,000 per illegal dose sold, transferred, or distributed, and potential revocation of the pharmacy or business license of the violator. And the effective date is that it would take effect upon passage. And what we have found also is that most of these non-FDA approved ingredients come from China, and they are obviously usually not registered or inspected by the FDA. So that's a brief capsule of summary of the bill. I'll be happy to answer any questions.
Senator Parks has a question.
Senator Fillingham, are you aware that it's already illegal for a 503A to produce or compound a a GLP-1?
I am, but I'm also told, at least, and you know better than I, that our Board of Pharmacy feels like they don't have the tools to enforce that here in Mississippi.
But I guess I would take it one step further. A GLP-1 doctor can, in the state of Mississippi, the medical board is already finding and speaking with the physicians that are writing those prescriptions where there's a deviation, where they're adding a vitamin B or what have you, or supplementing and adding supplement, make it something different. So there are multiple things that I see in this bill, and I appreciate the reverse repealer, but by the same token, we already have things in place. And have you spoken to the Board of Pharmacy, and are they in favor of this bill? 2
of the Board of Pharmacy members, Mr. Ryan Harper from District 3 and David Hudson from District 2, were consulted in the drafting this legislation.
Thank you.
And again, I defer to your knowledge. It's far more vast than my infinitesimally small knowledge of this topic, admittedly. But I hear what you're saying is that if the FDA approved drugs are required to be used, that's essentially what this bill is reiterating. So if the Board of Pharmacy doesn't feel that they have the tools currently to go after bad actors, I think the purpose of this is to merely give them those tools.
I'd like to speak on the bill at the appropriate time.
There's no time like the present.
Thank you. And I do appreciate the fact that you're wanting to put the reverse repealer in there and those type things, and that you're wanting to narrow that scope to GLP-1s. What I would like to do is just make this committee aware that if we do vote to move this bill further down the path, that we don't allow other things to creep into this. And I'll be specific to dermatology, the dermatologist. There are often compounding needs. Some of you may have experienced it with your children or yourself, where there has to be some specialty compounding. And with that being said, that's not all of those ingredients are even required FDA approval. And then the second thing that I would tell you about this is that the FDA doesn't visit our pharmacist on a regular basis of every 2 years. You're lucky if you would get to do that. And in this bill, it says that if, there hasn't been a visit within 2 years, then that's an automatic that you're going to be penalized with a fine. So again, I think we have to be very, very, very careful with this bill. The same thing would be with our OBGYNs and the hormone, some of the compounding that's done for those specific pregnancies and things of that nature. This bill is dangerous in a lot of ways that would be very, very harmful to our citizenship of Mississippi. I am not in favor of GLP-1s being compounded either by a 503A or a 503B. I want to be perfectly clear about that. I'm in no way am I in favor of that, because there have been a lot of bad things that have happened, a lot of bad actors. But I do think we have to be very, very careful if we let this bill continue to stay alive and work on it. That's all.
Senator Hill.
Thank you, Ms. Chairman. I share some of the concerns with Senator Parks because, I have had to have some specific drugs compounded for my family who is severely allergic to poison ivy. And typically it's your mom and pop pharmacy that are going to be able to compound these drugs. And they're already facing so much hardship from dealing with PBMs. And I know that this body tried diligently to help alleviate that situation, but I see this bill as potentially having a detrimental impact on the folks that do compound, because it can get very technical. And if somebody can't produce a drug that I need or my family needs, or the shortage is that there's a supply shortage, if there's any way that some local pharmacist can compound something that can help my relative when they can't get a drug that may be coming from overseas, maybe out of supply, I don't want to take a chance on hamstringing them or making them afraid to be able to make some kind of drug that is desperately needed.
Anyone else? Senator Boyd.
I understand the purpose of the bill. However, I'm going to go back to something that Senator Parks said. To me, this would be best dealt with by the Board of Pharmacy with penalties and provisions so that they can look at this. And I'm not understanding still, to her question, what provisions that they need and what is hindering them from being able to use what's already on the books in their policies and procedures and rules and regulations from enforcing this. So, and I too have seen the various people selling it that are not appropriate and are not pharmacies selling this. So again, if this goes forward, I want to see those questions answered as to why the Board of Pharmacy can't handle this under their rules and regulations. And if that's the case, that's what we need to be changing, not something specifically directed at a particular drug, is my opinion.
Anyone else? Senator England.
Thank you, Chairman Bryan. I figured I'd get my money's worth today as a new member of this committee. I just want to echo some of the concerns that my colleagues have, and I know that Senator Filligan, you're always willing to talk on these. My concern is that when these GLP-1 drugs, sometimes they're not able to be mass produced in a way that fits individual needs. And one of my concerns in Mississippi is that a lot of times we tend to treat symptoms of things like obesity, where we could, maybe treat the obesity itself. And I know a lot of these drugs are designed to do that. I'm glad you've got a reverse repealer in it, and it was obviously an amendment that you made, seeing that some of these concerns are out there. So I'd be interested to continue this conversation, of course. because I worry that if we do things that make those GLP-1 drugs less available, even if they may be in compliance with 503A and things like that, or if we make it tougher and regulated and in a way that makes it tougher even for people that are going to do it legally, that might have a chilling effect on addressing a problem that I think we have in Mississippi, which is obesity and other issues like that, where if we can get a hold of that, we could potentially see health costs come down as a whole, as a state. So I do appreciate you being willing to listen to some of these concerns with the fact that you put a reverse repealer in the bill. Thank you.
Anyone else? The matter before us is the amendment that Senator Fielding offered, which includes the reverse repealer. Are you ready to vote on the amendment? All in favor of the amendment, say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Now we're back on the bill. Given the two amendments, we might as well do a committee sub. Senator Fielding moves title sufficient do pass committee sub to debate on that motion. Are you ready to vote? Senator Fielding.
Thank you, Mr. Chairman. I appreciate the debate. And look, no one's going to hurt my feelings no matter how you vote on this. I don't get involved personally on that kind of situation. I will just say the intent of the legislation is to try to rein in what we have already seen a small amount of in our state. And I don't want us to see a proliferation of this where people are getting sold bad drugs that cause damage to them, which again is why I offered the two amendments to restrict it just to GLP-1 drugs, because I think that's where we're seeing the greatest potential for the abuse. And I agree with Senator Boyd that if the Board of Pharmacy could already do this, they should already be doing this. And I don't know otherwise why they haven't already done this as it related to the instance down in Southwest Mississippi and other situations. So I think there's a problem. If this is not the right vehicle to address that problem, then hopefully we've started a conversation that can direct people to try to address said problem. But with that, I appreciate the chairman and the committee's indulgence on the bill.
You ready to vote? The motion's title sufficient do pass committee sub. All in favor say aye. All opposed, no.
No.
Chair's in doubt. All in favor, would you raise your hand? I'll ask the secretary to count. All opposed? Say what? By a vote of 7 yeas, 9 nays, the motion fails. The next item on the agenda is Senate Bill 27. Let me try again. The next item on the agenda is Senate Bill 2566, State Board of Cosmetology and Barbering. That's Senator Johnson's bill. I'll recognize Senator Johnson. Do you have a motion or two?
Yes, sir. My motion is title sufficient do pass committee sub.
You're recognized to speak on that motion.
Thank you, Mr. Chairman. We talked about this last week when the Cosmetology Board stopped by to visit with us. The Board of Barber and Cosmetology has faced several issues since its inception from legislation a couple of years ago. Narrowing those down to 3 overarching issues have been a lack of a good software system, which has been appropriated for. And I think that with the new board that can be in place soon. There were some issues with board regulations that were not fitting with the people who were operating in state in the various levels under the board. And then there were some issues with code that in some ways boxed the board in on some issues, but also were not clear and streamlined. We met prior to session working on ways that we could improve the code and found several ways that we could do that. Then since the new board has come in, they have also found more ways. What I'd like to do is give you a very short, brief overview, although there are many changes. Most of them are technical and just making things function more smoothly. And there are more to come. So we have a reverse repealer in this as that since the new board has just recently come online and had a meeting Sunday, we don't have all of those updates yet. But briefly, I'll give you an overview of what the intent of what we are doing, and I'm happy to clarify anything that somebody has questions about. We want to streamline the licensing process. We want to clear up some issues around who can do test proctoring and what tests are required for which field you're in, plus being an instructor, whether we should license for a master, say cosmetologist, and what that looks like. There were some issues with fines on some very simple things that could be issued as a warning. We needed to clarify code to give that authorization. We're looking to do that. And then clear up some definitions. I would love to go through all of them with you, but it may take 2 hours and I don't want to bore you to death. Just know that the idea is that we clarify code so that it is a more functioning system for both the board, the executive director, and the licensees. And so that's what we're working towards. With the committee's indulgence, I'd like to move forward with this and with the reverse repealer and continue to work on it.
Are there questions for Senator Johnson, Senator Wiggins?
Thank you, Mr. Chairman. And this question may actually be for the chairman too, but so I heard the presentation last week. I was impressed. I thought we're making progress. I get contacted by barber who I respect, couple, and it's like, this ain't working. I was like, what? We had this whole presentation, board seem, and and then I'm told about not happy with what the board is doing, lowering standard. Let me say, I feel like we were making progress, and understanding there's always people who aren't going to be happy. So, but I respect these folks, and so I just want to be sure that we're going somewhere. And then somebody made I said, well, there's a board and they got elected, and that's not right, and all this other stuff. So you may have insights that I don't. It's been my desire that we solve this issue. It sounds like, Senator Johnson, you're doing that, but I keep getting this comments from barbers. So can you help me out?
Well, I think, and I'm going to read into what I think you're asking, is that some people who have a current license are upset about the potential for the license. What would be the requirements to get a license being lowered from what they had in the past? Is that accurate?
Based on what was told to me, yes.
And I think,
but that's not the only issue, but yes, that was specifically mentioned.
Yep. So I think multiple states have gone to going with just a written examination instead of written and practical examination. And so I believe our board is looking to, in February, I believe, or sometime later this month, right now, go with not requiring the practical examination and sticking with just the written examination. I think that's a trend that's coming. The practical examinations, I would not say that they are not useful in some ways, but they're very subjective, and not necessary to do a good job at cosmetology or barbering. I believe also there is a lowering of some hours from 1,000 to 600, which we can debate whether those additional 400, I mean, it's an extra 67% from the 600, so maybe it matters, but I think there is a point where we can make arguments on a diminishing return or that it is not an upside for requiring more hours. So I believe that the board has taken into consideration what other states have done, the outcomes in those states, and are trying to move our board forward or our regulations forward based on that. And so I can see where some people may feel like it's being devalued. I don't believe that's the case, though.
The purpose of the board is, and I understand this is a new board, is, to oversee and regulate the industry. But I think the board is just advisable if they communicate and they listen to their members and, have policy, I guess, discussions and debates, which I think you would agree with that. And there may just need to be some seasoning or whatever, a little bit of time to pass for those things to happen is what it sounds like to me.
Maybe, but I don't know that by doing that, you stick with the status quo until you can make those changes. I don't necessarily believe that that's the right path. I think the board.
No, let me be clear. I'm not saying to end the board. I'm saying it's new, it's constituted, and this board has to get into the middle of things and start making so that people are used to how things are, because that's not how it was being run before.
That's right. And people were unhappy with how it was run before. So I think that we're getting off to a better start. I've met with several of the board members. I have a lot of confidence in their ability and their desire to do what's right for their industries and the practitioners within that industry.
Anyone else? Senator Johnson moves title sufficient to pass committee sub. Are you ready to vote? All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2749 is the Long-Term Care Ombudsman Act. Senator Blackwell, this is your bill. I'll recognize you.
Thank you, Mr. Chairman. This bill comes to us at the request of the Department of Human Services. The state long-term care ombudsman provides services for residents in long-term care facilities that protect the health, safety, welfare, and the rights of residents through leadership, oversight, and monitoring. The Ombudsman program is authorized by the Federal Order Americans Act. Mississippi Code sections 43, 4751 through 43, 4779 are the current statutes governing the Division of Aging and Adult Services, more specifically, the state ombudsman, and they are outdated. These laws were enacted prior to the establishment of the Mississippi Department of Human Services and the enactment of the Older Americans Act of 1965, which provides regulations for federal compliance. The current law is inconsistent with the duties and responsibilities outlined by federal law for the Office of Long-Term Care Ombudsman. And the purpose of the proposed changes to comply with the Older American Act of 1964 and 2024 Older American Act Final Rule. So the proposed legislation affirms the ombudsman's authority to oversee representatives of the office and local councils in accordance with federal regulations. It clarifies that local and community ombudsmen are not mandated reporters, and it updates relevant definitions to align the current federal regulations as well as state policies and procedures as outlined in 45 CFR. That's a brief explanation of the bill, and I'll yield for questions.
Questions? Debate? Anyone? Senator Blackwell moves title sufficient to pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The next item on the agenda is Senate Bill 2444. Senator Hickman, would you like to make a motion on that bill?
I move title sufficient to pass.
You're recognized to speak.
Thank you, Mr. Chairman. This bill is a bill that basically would require the Department of Health to put together a work group and study diabetes as it relates to amputations in the state of Mississippi. I will say, I think most of us around this table have a personal example or a personal story of someone who is living with or had diabetes. This is going to look at how we can better treat that in the state, because Mississippi's amputation rate is double the national average. See how we can treat this better, how we can save the state money and have healthier Mississippians. It just requires that they put together a work group and report back a study in ways that we can help treat diabetes and get into public and private partnerships to help us better assist with this issue. That's what the bill does. I will yield if there are any questions.
Some of us have a committee sub in front of us.
Oh, title sufficient. Oh, well, let's adopt the committee sub. Sorry, Mr. Chairman, we do have a committee sub.
I assume you want to move title sufficient to pass committee sub.
Yes, that's exactly what I'd like to move.
Questions? Senator Hobson?
Thank you, Mr. Chairman. Is there a study or any studies that are already done or being done by UMMC or other entities in the state?
Not that I am aware. The original bill started out by requiring them, but we thought it'd be a better fit that Department of Health would look into this, and I think they've agreed to.
Are there national studies that they could look at so they don't have to expend other dollars to get the answers that they need?
And that may be the case, because what they're doing, we've not asked them, this is not like a whole study group. We've asked them to put together a work group within whatever they have, and they may just conduct national studies. Read national studies and just give us a report of what we can do and how we can assist with this prevailing issue.
If I understand your committee sub properly, this is just to study why so many amputations are taking place as opposed to what causes diabetes. Am I
Right.
correct?
Why there are so many amputations, how we can better treat diabetes so it doesn't get to that point of amputation, because our amputation rate is double that of the national average.
Well, thank you. I would just like, before we advance this, to see if there are other studies, rather than have them expend resources on that. Not that I'm opposed to that if there aren't studies or information available, rather than expend the resources, there may be other things that they can look at quickly and are already being done to assist in this regard. And that may just not being implemented. I just don't know.
And I agree with you, but I don't, from my understanding, they haven't looked at this particular issue of amputation, maybe some studies around diabetes and all that kind of stuff. And again, if it is, I think we could stop this or amend it or whatever if we have to.
Okay, thank you.
Thank you.
Senator. Thank you, Mr. Chair.
Anyone else? The vote occurs on the motion title sufficient to pass committee sub. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The remaining matter before the committee is Senate Bill 2464. Senator Hickman, you're in my line of sight. Would you be interested in moving title sufficient to pass committee sub with the committee sub including a reverse repealer?
Yes, that would be my motion.
Excellent motion.
Thank you.
Senator Hickman. This is my thought about this bill. There's several bills that were introduced involving the general area of the Department of Human Services and child care. After we had the hearing, I've had numerous people contact me and insist that there are additional funds which could be used for child care, not merely for those who are receiving TANF cash payments, but for many others. And I think it's worth looking at that further. And again, just for the purpose of having a vehicle in case we need legislation. I've brought this before the committee, and Senator Hickman's motion includes a reverse repealer. I don't intend to let this or anything else get out of control, but I think it's useful to keep this thought alive. Having said that, are there questions? You ready to vote? Votes title sufficient to pass committee substitute. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The committee, I hope, knows how much I appreciate their hard work and how much I respect their various views and their input. It's just the beginning of the session. Hang in there. We got a ways to go. There's a motion that we rise and report. All in favor, aye. All opposed, no. The ayes have it.